individuals often feel a heightened sense of love of self and others, and tend to move into a state of self-acceptance, often for many people for the first time in their lives. Hello, I'm Dr. Michael Hofrath. Today I'd like to provide an introduction to MDMA-assisted therapy and discuss a little bit about what assisted therapy is. So let me start by saying that ecstasy or sassafras is not necessarily MDMA. These are street names for drugs sold on the street that are often cut with numerous adulterants, including amphetamines. During this discussion, when I refer to MDMA, I will be referring to pharmaceutical grade or close to pharmaceutical grade MDMA, which is not cut with other substances or adulterants. The scientific term for MDMA, it's a difficult term, let me see if I can get this out, is 3,4-methylene dioxide methamphetamine. It's considered a psychostimulant that produces heightened mood and facilitates social communication. MDMA effects are primarily mediated by serotonin, or 5-HT, but also by dopamine, which is DA, and possibly noradrenaline, which is NA. MDMA is a great tool and vehicle for psychotherapy for numerous reasons. For instance, safe access to traumatic memories, enhances empathy, is almost always pleasurable and can even be euphoric, less perceptually disturbing than classical psychedelics, decreases depression, anxiety, fear, and aggression, increases our level of alertness and self-confidence, promotes a sense of serenity, peace, and relaxation, instigates a mood of positivity, and enhances creative thinking. It also releases oxytocin, which facilitates empathy and connectedness with others. Lastly, MDMA inhibits normal fear responses. So what does MDMA feel like? Well, the subjective experience for the majority of people who've experienced MDMA is that it produces a state of euphoria. However, in many ways, it is a truth-love medicine. Individuals often feel a heightened sense of love of self and others, and tend to move into a state of self-acceptance, often for many people for the first time in their lives, which can be very empowering. Individuals often experience increased confidence and self-worth, which are invaluable states during any therapeutic or psychotherapy process. This medicine allows individuals to drop down into the underworld of psyche and into the shadow, or as I refer to it, Pandora's box, without debilitating fear. This allows them to work through uncomfortable memories, events, feelings, programs, and adverse behaviors. This medicine has empathogenic effects, meaning it increases feelings of empathy towards self and others at low doses, and can have minimal psychedelic effects at higher doses, or with certain derivatives of MDMA, such as MDA or 2CB, which I'm not going to be discussing today. Most individuals feel a heightened state of euphoria, safety, calm, and peace. The absence of fear is what makes this medicine such a powerful healing agent. The body's senses become more acute and enhanced. On this medicine, individuals become more aware of sound. They hear background sounds and noises they wouldn't normally notice. For instance, music sounds better, hence the reason why ecstasy is the drug of choice at festivals and raves. Temperature tends to fluctuate. 1 minute, somebody may feel a little chilly. The next, they may feel a little warm. Despite being an appetite suppressant, certain foods and drinks actually taste better on this medicine. Additionally, individuals' sense of touch is also greatly enhanced. Often individuals become somewhat touchy-feely, more affectionate on this medicine, since the feeling of self-love and love for others is enhanced. This aspect of the medicine is rarely discussed, but it's my experience that individuals' sense of consciousness and intuition, or their third eye, are often enhanced as well. Clients feel more connected to self, nature, animals, and the world at large. They're often surprised at how much of their inner landscape they already knew, but were not consciously aware of before, or didn't think they knew. Individuals have a greater sense of interpersonal relational awareness as well, thus a sense of oneness with the world. And a lot of times they often describe a deeper sense of spirituality or connection to a God or a higher power. MDMA is the preferred entheogen for the resolution of trauma because its effects are more easily controlled and predictable than most other psychedelics, including LSD or psilocybin. It is common for individuals to feel as if all their questions, concerns, and issues have been addressed and answered. While under the influence of this medicine, fear dissolves, which makes it the perfect medicine to explore deeper traumatic memories and shadow-related issues. Depression, anxiety, feeling uncomfortable in one's own skin or in their body and in life often stem from a distorted sense of self, self-hatred, and or self-loathing. Because the shadow prefers to remain hidden, these deeper issues can be very difficult to access, yet resolve through talk therapy alone. They tend to require movement deeper into the unconscious psyche, deeper into soma, the body, and deeper into soul for resolution. If left unresolved, many of these issues manifest through self-destructive behavior, self-sabotage, substance abuse, eating disorders, and numerous other escapist behaviors, such as numbing, avoidance, or even isolation. All these sabotaging behaviors can be very debilitating, making individuals feel stuck, alone, or lost. This medicine allows for the embodiment of self-love, which easily triumphs over previous anxieties surrounding love of self. This fearless state allows individuals to move into self-acceptance, self-forgiveness, forgiveness of others, and self-love. Acceptance of self, despite previous traumatic events and memories, opens the path to healing. Often individuals state feeling safe in their body for the first time, an increased sense of self-love and harmony for the first time in their life. Clients often describe feeling more hopeful and more socially connected, which are two very crucial concerns for individuals experiencing depression, anxiety, mood disorders, or numerous other emotional issues. This medicine can provide a renewed sense of courage and strength, promoting a sense of hope in a client's capacity to manage their life and to deal with life on life's terms. Feelings of loneliness are a major concern in today's fast-paced, disconnected society. We tend to rely on digital connections, which are pseudo-connections at best, and typically tend to be very superficial, versus making real in-person social connections with others. The MDMA experience often provides a sense of belonging to something bigger than self. It is not uncommon for clients to feel a sense of being connected to all of humankind and nature. MDMA-assisted therapy can effectively interrupt chronic programmed feelings of depression, anxiety, hopelessness, and isolation. The beauty of this experience is that clients can realize and feel the result of successful therapy in advance. MDMA leads clients to the real truth, points out the real path to take, and provides internal incentive to work on behavioral issues and life goals, which once may have seemed impossible to pursue. At the peak of the MDMA experience, clients can be transported through visualization toward their realized goal and ultimate self-realized destination. This medicine is very powerful in assisting individuals with clearing away all the emotional garbage that held them back and that we often hold on to and struggle to let go of. This medicine is an extremely valuable resource for processing previously challenging experiences and for healing relationships. Clients tend to gain a clear understanding of what they need to do to move forward without fear and resistance. Often clients visualize attaining their goals and moving into their higher self. Now, the caveat to such a successful outcome is having an experienced facilitator and integration specialist to assist them in the processing and integration of mystical and numinous experiences. An important construct inherent in most psychedelic assisted therapies, but especially in MDMA therapy, is that therapeutic gains from a neurophysiological and neurobiological perspective can be long-term if individuals are willing to do the work after their medicine experience. It is important to understand that the medicine MDMA itself is not a magic pill. Yes, true, the medicine expedites the healing process by allowing clients to access truth, repressed feelings such as shame, guilt, and fear expediently. However, the real work and the process of behavioral change begins after the medicine journey itself. From a neurobiological perspective, the brain possesses the property of neuroplasticity. The brain is very efficient at pruning off neural pathways where the activation level is reduced and then replaces them with higher activated neural pathways. With proper integration, positive behavioral changes become more embodied and eventually become a person's new way of being. This process can take several weeks to several months to be completed, but that's a far cry from having to participate in talk therapy for weeks, months, or years, with a lot of times no real lasting results. To elaborate further, neuroplasticity entails cleansing the psyche of dysfunctional and traumatic imprints programmed from childhood and the past, while recovering the capacity to love through an open heart. While spiritual states tend to be somewhat transient, new spiritual insights and revelations can provide clarity and understandings to bring clients closer to their spiritual potential. Thank you for watching today. I am Dr. Michael Hofrath, and I look forward to being of service in any way that I can.